Good morning, I'm Steve Giammona. I'm a physical therapist with Beaufort Memorial Hospital.
And my name is Mary Benedict. I'm a physical therapist as well.
We're going to go over today a few of the exercises you can do to help prepare yourself for your total knee replacement. It's been shown that being prepared for your total knee replacement and having your muscles flexible and tone will help improve your outcomes and in turn get you to recover quicker. So we'll go over a few of those exercises today that will help make sure that you have good flexibility as well as good strength coming into your total knee replacement. The first one we're going to go over is an exercise called the heel slide. This is used to make sure you have good range of motion of the knee as well as making sure that there's no limitations in how well the knee bends. You'll simply lay down on a flat surface and slide your heel towards your buttocks. This works really good in your bed or using a ball under your heel or simply a towel underneath there so it slides easy up and down. We can repeat this process doing 2 sets of 10, making sure that the knee is coming all the way up into its flexion position and then all the way down into extension. Once in this position, you finished your 2 sets of 10. Then we'll keep the left knee bent to help protect your back while you do the second one called the straight leg raises. In this position, you'll point your toes towards your nose, tense up the quadricep muscle, and lift the leg no higher than the other knee. Hold that for about 3 to 5 seconds and lower it down slowly. We'll try to, once again, do 2 sets of 10 of these, increasing the tone in both your hip and your lower extremity. Once you're comfortable with that one, we're going to try to do what are called long arc quads. You'll sit up on the edge of a firm surface. The edge of your bed will work. Put the edge of the surface right up against the back of your knee. And in this position, you'll raise the leg up, hold for about 3 to 5 seconds, and then lower it down slowly. Once again, we'll try to do these for 2 sets of 10 as you raise and lower. You may feel the kneecap sliding. There may be crunching or cracking and popping in there for what's called crepitus. But we want to try to make sure that range is there as well as the tone in a muscle called the VMO that helps the kneecap track correctly. The better we have tone in this muscle, the sooner it will come back after surgery. The next activity we'll do is what's called a hamstring stretch. If you'll sit with one foot dangling off the table or in contact with the floor, the other leg out in front of you, you can, in this position, use a belt, a dog leash, or a strap of some sort. Sit up tall with the chest out, point your toes towards your nose, and try to lower the knee down into the surface. You may feel quite a pull up the back of the leg as you do this. This is called the hamstring stretch. Try to hold it for about 30 seconds, breathing, not holding your breath, and just letting that muscle stretch. You may be able to slightly tilt the foot left or right and feel some of the tighter fibers, as well as slightly rotating your chest to one side or the other to find those tight fibers. This is important for getting full knee extension after the surgery, which of course is important to be able to stand. In this position, you can also bend the knee slightly and stretch the soleus muscle with a slight bend in the knee. In that other position, you stretch both the gastroc, but in this position, you'll stretch the soleus muscle. Again, holding for about 30 seconds and then easing off. Good to go ahead and do both sides with this. Both legs are important to us. You're going to need to have one good leg to stand on while you're recovering, and so we want to make sure they're equal and balanced in this recovery. Next, we're going to go over some exercises to work on making sure the arms are good and strong prior to surgery. Your arms need to be strong as well in order to help you with walking with a walker, pushing yourself up out of bed, getting on and off the bedside commode. So this exercise is called the Tricep Extension push-up. In this position, with an armchair, you can use your feet slightly up underneath you and push yourself straight up. Hold for about 3 to 5 seconds and then down slowly. Now this is not the typical way you'll stand up, but this does make the arms work a little longer to help you strengthen that. Normally we'll look for a transfer to include your nose reaching out over your toes to improve the physics of transferring from sit to stand. So Mary's doing several of these. We'll again try to work up to doing 2 sets of 10 of this position. So a progression of this would be doing the sit to stand exercise We'll talk a little bit more about that nose over toes concept here. If you draw the feet back slightly underneath you, you'll reach forward with your nose until it passes the plane of your toes and then stand up. In that position, you'll kind of squeeze your buttocks, kind of tense the buttocks, and then you can lower back down, slow and controlled. Getting this concept of nose reaching out over your toes will help make the transfers from sit to stand easier. Again, you can try to do 2 sets of 10 of these. If you need to, you can use your arms. More advanced would be to try to do it with your arms crossed and lift from that position. Next, what we'll try to go over is a stretch called the quadricep stretch. This helps with your range of motion and how well the knee bends. By placing your foot up in a chair, holding onto a firm surface, either the counter or the back of another chair, you'll stand in this position, squeeze the buttocks, push your belly button forward, and you'll feel a pulling motion up the front of the knee. Hold that for about 20 to 30 seconds, and then rotate to the other side, and again repeat. It's important for both legs, again, to be good, flexible, and strong, because we need to make sure you have those good legs to stand on and that both sides are balanced and similar. The next exercise we're going to go over is what's called the toe heel raises. This will help strengthen the calves and work your balance reactions in your foot and ankle. By standing next to a firm surface, either the back of a steady chair or your kitchen counter, you can raise up onto your toes, hold it for about 3 to 5 seconds, and then rock back onto your heels. Balance is important, of course, as you're recovering from your knee surgery. You'll have a walker to help you initially and then progress to using a cane, but we want to start waking up those balance reactions and making sure that you're prepared for your knee replacement. The next one we're going to do is try to do what's called a weight shift. As you start to learn to put weight on your new knee, we want to make sure that you're comfortable with it. So feeling that weight shift prior to entering the hospital is a great way to practice that. Holding onto your firm surface, rocking forward to your toes, and then back on your heels, shifting your weight from left foot to right foot as you move forward and backwards. Great. Following your knee replacement, ice will be your friend. By elevating your feet higher than your heart, we'll use several ways of trying to control the swelling in your knee. So once we're in the elevated position with the feet higher than the heart, you can attain this by using a wedge, one of your couch cushions, or stacking multiple pillows. We'll put the ice in place, and then we'll do what are called the anti-embolism exercises to help milk any of the excess edema or fluid out of the leg. So in this position, the first exercise we'll do are called ankle pumps. You'll up and down, plantar flexing and dorsiflexing the feet. I call them the gas pedals. Up and down, on and off the gas pedal, turning the calf muscles on, creating a milking motion, and making the skeletal muscle pump to help move the fluid out of your legs. Secondly, we'll try to do one exercise called the quad sets. I call them the bug squishes. We imagine a bug just crawled up under your knee and you're trying to squish it. You push down, hold, 1, 2, 3, and relax. And you can do that on both legs at the same time, helping move that fluid further towards the heart. Finally, you'll do an exercise called the glute sets or butt squeezes. Try to squeeze the glutes together, hold for 3 to 5 seconds, and relax. Doing these in the sequential order will help move that fluid out of the legs, minimize your swelling, and in turn decrease your amount of pain you're experiencing. Great to do this after your regular exercises that you've been prescribed, or even before you go to bed to help give you a little comfort before you try to rest for the evening.